Across the country, there was a record number of opioid-related deaths as COVID first shut down the country back in 2020. And just last year, more than 100,000 people died of drug overdoses.
In New York, there is a new face now in the fight behind fighting this epidemic, and she's taking a different approach in this battle. It's a story you're only seeing on 13.
We can't continue along this path, and people are dying every day.
Dr. Chinazo Cunningham has big plans for how to fight drug overdoses.
In Schenectady, we reported there were 4 overdose deaths just in a single week. So how would you describe the overdose problem in the capital region in particular?
The numbers are continuing to increase. It's not going to get better anytime soon until we really expand our services, tremendously.
Marking 6 months now as the leader of the New York State Office of Addiction Services and Supports, known as OASAS, she wants to heavily implement a harm reduction approach, bringing support and treatment to areas where drug use is highest, including jails and homeless shelters. She wants to vastly increase distributing naloxone, fentanyl test strips, also offer more clean syringes and alcohol swabs to make sure injection sites are clean.
The argument against it is that this enables drug users. It enables drug abuse. What would you say to that?
Yeah, so we know there's decades of evidence around harm reduction approach, which that is just not accurate. And we have so much evidence to say it saves people's lives. Stopping using drugs is hard, right? If it wasn't hard, we wouldn't be where we are right now as a country. And so if people relapse, which is part of the disease, that we don't kick them out of treatment.
She was a college athlete. She went to Northwestern University on a softball scholarship, became a physician working in the Bronx for 20 years. During the HIV epidemic, she went door to door while pregnant at hotels in some of the poorest neighborhoods, working to bring help to people addicted to drugs.
We can't expect certain parts of the population who are really marginalized to come to us in the healthcare system, right? We have to go to them.
What would you like to say to people who just feel like, why isn't this being fixed now, right? What's taking so long? Why does it feel like things are getting worse?
What I would say is that this system has been a bit broken for decades and hasn't gotten the resources that it's needed.
And those resources, she talks about funding from opioid settlements. We heard the AG talk about that. Also collaboration from the state and the federal government. Also $1.6 million will go to 8 addiction services providers, and they're going to launch medical units to go to those areas that are high risk.
She seems to have a lot of energy at a time when it's needed.
Yes, and great experience behind her. So we'll see what happens.
Yeah.